That never gets old. It is time for our bi-weekly chit-chat with Dr. Jaimie Ronchetto from Cinema Veterinary Center. And I will say, because I have 3 beagles, 2 of which I've taken to Dr. Ronchetto recently, Daisy, and then Otis, who at the age of 11 needed like his 100,000-mile tune-up. So he had a growth on his eye, which was starting to get bigger and starting to get really funky looking. And then while we were getting the surgery done, we also got his teeth cleaned, and then he had a dew claw. His dew claw was never removed, and it was getting really long and almost growing into his skin, and he wouldn't let us clip it. So all those little things, it's like, while we're at it, top off the tank, you know. So Otis, we were talking off the air, Doctor. Otis is doing really good. His eye looks really good. He's a handsome little boy, and you even did the check to make sure that the growth was benign. Right. So that was good news. So thank you for that.
You're welcome.
And the level of service and the follow-up and also getting the email stuff back and forth is really good. The email appointment reminders, which are great for me. So I think we're bringing him in for one final check tomorrow. And but a really good service, and he is. I think he's feeling better.
Wonderful.
But I want to talk about this because our esteemed leader got an email from Cinema Veterinary Center talking about a heartworm case, and this seems kind of serious. Why would that be?
So a heartworm is a parasitic disease transmitted by mosquitoes, and it's not that common down here in this area. It would be much more common, say, if we were to be back east or somewhere like that, where heartworm's really rampant. But we do see it from time to time. So the other week, we actually tested a dog. We have in-house blood tests. It takes 10 minutes to run, and typically they're all negative. That's what we would typically expect down in this area, but we got a positive. We confirmed it with an outside test to an outside lab to rerun a test just to make sure it wasn't a false positive on our part, and it was truly positive. And it's just important to continue to be educating the public that, although rare, we do see it here, and for that reason, because it's so difficult to actually prevent the mosquitoes, and it's so easy for them to bite without even really realizing it, it's very important to keep everybody on heartworm prevention, which would be a monthly, in our case, what we carry is HeartGuard, which is a monthly chewable treat type of medication that prevents the heartworm from actually becoming a problem.
Since this is so rare, can you enlighten me as to what a heartworm actually is, or what effects it has?
Yeah, absolutely. So heartworm is an actual parasite. Like I said, it's transmitted through mosquitoes who would actually be carrying the larvae inside them. So if they take a blood meal from your dog, let's say, they would actually inject it into them that way. They travel through the skin down inside and then develop in the pulmonary vessels. So they're actually physically a heartworm. And they can multiply there, and in larger numbers of adult worms, they actually start to fill up the heart chambers and can cause heart failure.
Oh my.
Yeah.
It just made me like feel my chest. Okay, I don't have any, right? Yeah. But this is different from like when we talk about getting dewormed and things like that. Those are things that are more inherent in puppies and kittens.
Correct.
And it is not heartworm.
Yeah, those are more intestinal parasites, right. And those are much more common and easily treatable. Heartworm disease, should you get a positive result, it's much more difficult and more costly to treat the actual disease and get rid of the worms rather than to just prevent.
What is the treatment?
The treatment is basically getting them started on the HeartGuard or a similar medication, so the monthly preventative, and we start them on that for a couple months first, and then we actually have them back in to do injections, and the injections are by a deep intramuscular injection, and that is to kill the adults. So we start off our treatment with the tablets to try to kill off the larvae, the young ones, and then we kill off the adults. And we try to not do it too quickly, because if a large number die at once, that can cause problems too.
Right.
Too many shedding at once.
Wow. So it is relatively serious on a level, especially seeing that. It
Yes.
makes sure that we all take our dogs in. Now, is this just is it exclusive for dogs, or is it cats too? Or
Cats can get it too. a lot of cats are indoor cats, and certainly mosquitoes can still get indoors, so they are still potentially at risk. The heartworm tests for cats are not as specific or sensitive, and so basically for kitties, they don't do the injections like dogs would. We would just start them on monthly preventatives, which for kitties is typically more of a topical medication than oral.
So it's a good opportunity. Have your pet checked out for heartworm, especially since there is one case, there could be more. Not to scare you, but it's always best to be sure. So Cinema Veterinary Center, located on Cinema Drive in beautiful downtown Valencia, cinemavet.com. Phone number is
661-253-9300.
Ding, ding. Thanks so much, Dr. Ronchetto. And again, Otis is doing great, so thank you so much for all the care you've given him, and Daisy as well.